The definition of trauma is the stimulus is greater than what the organism is designed to process in its customary way. What this means is when this event strikes, it hijacks the nervous system. And what happens when the nervous system is hijacked is the thinking part of the brain, which is this front part here, the prefrontal cortex, and the verbal part of the brain, Broca's and Wernicke's area, which are right here on the left side, this is a mirror image, are offline. They're not firing, and what we've got firing is the limbic brain, the survival, the emotional survival brain that basically is the fight-flight response that we are running from a tiger. So the person who is in trauma cannot think or speak. They are in speechless terror. This data comes out in 1996. In 2003, we learned from Ruth Lanius about the inescapable shock situation. This is very relevant to us with neglect trauma. And the inescapable shock situation is as follows. When a mammal or a creature like us are cornered, and we'll use the example of a prey animal being cornered by a predator, and it can't get away, and it can't fight, and it can't flee, what is it going to do? Well, it has two options. One of them is to ratchet down all of its bodily functions so low that the predator will think that they're dead. And when the predator thinks that they're dead, it will give up, run off, because most predators don't want to eat dead prey. So once the predator goes away, the prey animal makes sure the coast is clear, they reconstitute themselves, they find a safe place, they recover, and they wander back out into the woods where they were. That's the first option. The second option, and that one's called playing possum, because possums are famous for doing that. The second option is what we're most inclined to see in our offices, and that is they ratchet down their bodily functions so low that they won't feel the pain of being eaten. So there is almost nothing firing in that brain. It looks almost like the brain of a dead person. And the idea is to not feel the pain of being eaten. So that creature is completely numb. They don't feel emotion. They don't feel sensation. Their brain is pretty much offline except for a little tiny bit of the brainstem, which is the sort of primitive base of survival at all, but mostly they're not there. So you see what this brain looks like. Now we're going to talk about the very challenging task of creating or putting together their story, which is no small feat. So and as I said last week, one of the terrible nightmares of my own experience as a therapist, and probably a lot of you are too young to remember this, is what we went through in the early 90s, which was the false memory movement. And that was when people were talking more openly about sexual abuse and incest and all kinds of things that no one wanted to talk about that occurred in families. And so there was this whole myth that was created that was thought of as the false memory syndrome. And we were attacked of making up stories. And so we don't want to create false memories. So how do we unearth narrative? Well, one of the ways that we talked about last week was to talk about how what we know about what the mother was going through during the pregnancy, because that gives us a lot of information about the brain development of that unborn child. And then what do they know about what was going on in the parents' lives when they were young infants, toddlers, those early years that they don't have narrative memory about. This time, we're going to talk about some of the things that we see that are both some of the challenges of neglect-informed psychotherapy, which double as material or ways that we get their story. And so I will warn you that this part is complicated because we have to use so many parts of ourselves. We have to be so present with ourselves. So, one of the expressions of the inescapable shock situation is the freeze response. And we all know something about the freeze response, which in trauma literature sort of translates to the whole category of traumatic dissociation. And dissociation has two meanings, and they're related but distinct. And one of the meanings is the fracturing of the self. And way back, once again, before many of you came into the field, when I came into the field, the diagnosis of what is now called dissociative identity disorder was called multiple personalities, which is the person's personality fractures into all these different parts or selves. Now we think of it much more in terms of parts, and we've got the IFS model, internal family systems, and we've got the Janina Fisher model, which is trauma-informed stabilization therapy that really identify and work with parts. So dissociative fragmentation is where the self is split into parts. That's one of the definitions of dissociation. The other is what you see here, and that is the sort of spaced out freeze response where suddenly there's nobody there. And so we're going to talk about both of these versions of dissociation because both of them are some of the great challenges of this work, and both of them are also ways that we reconstruct the story. So, what we have to learn to do, and this is part of that first phase, is learning to recognize. We need to learn to recognize, and then we need to help them learn to recognize when they're being visited by a different part of themselves, when they're in some kind of re-experiencing of part of their trauma. What I learned about this client who called me ugly was that was his experience. His mother told his sister and communicated to him that he was disgusting. And sadly, in the attachment research, one of the one of the descriptors of the mother or the parent infant dyad in the attachment style that's associated with neglect, which is the avoidant, which I hate that word because it sounds intentional. It's not. But one of the characteristics or one of the tendencies of the parent in that dyad is the parent is repelled by the child's body. They don't want to touch their child. And this same person who called me ugly was able to tell me that his mother was disgusted by him, and he told his sister, she told his sister told him, but he could feel it. He could feel her revulsion of him and his body. I've also had clients, and I practice neurofeedback where you have to touch the client, and the client would literally flinch when I touched her head to fix the electrodes. She would jump, and she insisted on doing as much as possible of the placement of the electrodes and the part that involved touching her herself because she was so touch averse. That is the client re-experiencing something that was their story and inflicting it or projecting it or somehow giving you the experience in your own body, in your own emotional life. We need to help them begin to notice when they're in different states or different parts or different memory triggers in their own story. Partly because it helps them really take some charge, get some agency in their own recovery, and partly it helps us to really help them see when they're not here, they're in another state, they're in another part of their experience, their story, their fragmented narrative, which is trying to reconstitute itself.